In this module, we will be talking about communication in the return to work process. To discuss this, we have Anja with us. Welcome, Anja. Can you shortly introduce yourself?
Thank you, Lode, for inviting me. I'm Anja Marchal. I work as a certified return to work coordinator at Reumanet. Reumanet is a Flemish umbrella organization of patient organizations within rheumatology in Belgium. I worked there for a couple of years yet. I followed the training of disability management organized by National Health Institute here in Belgium in collaboration with NITMAR from Canada. And I try to use the disability principles into my work in supporting people with a rheumatic disease in the context of professional reintegration.
What's your experience with return to work?
I've got both personal and professional experience. Personal, I am self a patient with a rheumatic disease. Mm-hmm. Over almost 20 years I have rheumatoid arthritis, and it has an impact on the working floor. So I have adaptations within hours that I work per week. For this moment I work, for example, 13 hours a week. I can schedule my appointments whenever it's best for me, as possible as needed. I have fixed agenda points of meetings or reunions, or if I have coaching or support sessions, of course it's on appointment. Professionally, I support people with questions about RMDs, so rheumatic and musculoskeletal diseases, and professional reintegration. That can be patients, but also occupational doctors or doctors of the health insurance or other stakeholders that are important within the professional reintegration process.
Communication is very important within the reintegration process. Can you share your experiences with us?
Open and clear communication, I find it very, it's the key. Mm-hmm. So it's very crucial that there is the possibility to communicate with the employer or the employee in an open way. I know from practice that it's very difficult for people to tell what they need on the working floor. So it's good as an employer, but also for the other stakeholders to support that person in talking about the needs on the working floor, in searching for the correct or possible adaptations on the working place or next to it to facilitate everything.
You've mentioned the employer. Are there other important stakeholders that should be considered and involved in the communication process?
For me personally, the colleagues, because if there are adaptations on the working floor, you need the colleagues to work in a team to check if it's possible in daily practice. Also, the doctors of the health insurance can be supportive, and the occupational doctors on the working floor. And there next to, we have also in Belgium job coaches who work externally, but also intern on the working floor. You can find mentorships to support people on the working floor. And for me personally, I'm a patient expert. I'm trained to be to talk about my personal experience and to talk about the experience of other patients. And mostly the success stories about working with an RMD, that it is possible, can motivate as well employers as employees to talk about possible adaptations on the working floor. So that's really crucial also for me.
Thanks a lot, Anja, for sharing your expertise and experiences with us. If you want to know more and learn more about communication in the return to work process, I invite you to follow the rest of the module.